gentlemen, it is my honor to bring in Skylar Washington. Hello,
Hi, how are
Skylar. Well,
you?
you are on the mic with Mike. How you doing out there?
I'm good. How are you?
I'm great. I'm living the dream here. Glad to talk to you. So we're going to talk about the world, how you see things, because you have a lot of ideas, and we talked extensively. So let's talk. Give folks a little bit about your background, really quickly.
Well, my name is Skylar. I grew up in Richmond. I went to Glen Allen High School. I'm also Jewish. I was born Jewish,
So we're
and I'm
not going to get
black.
to the point of say when did you become Jewish.
Right. I was always Jewish, always black,
Okay.
and so it's been interesting.
Alrighty, so we were going to touch on a couple of things with you about your view of the world right now. So, folks, we brought Skylar in because we wanted to get her view as a young person, how we see things right here. So, I'm going to ask you a couple of questions. How is being Jewish, Jewish person of color, shaped how you see the civil unrest now?
Well, yeah, this question was the hardest of the three questions that you sent me,
Okay.
actually. Just because I feel like everything is very intersectional, especially just with my life. And it's hard, when you go through different periods of civil unrest and things come out of it, right? So you had the first wave of feminism when women got the right to vote. But it was white women, right?
Okay.
So then you have just the civil rights movement as well, but that was mostly black men. So now we have black men and white women, and it's very hard because that's where the intersectional part comes, right? Being a black woman and then also being Jewish. And it feels like you get left out a lot. I think that's kind of the feeling that I tend to feel whenever we're talking about these things. You get forgotten a lot as a black woman and as a Jewish black woman.
So
So
when
that's kind of where I am right now.
Okay, so when you're talking, so the boxes that are checked, you understand when people of color are talking, you understand that
Right.
part because when I see you, automatically you're a black woman. Okay,
Right. Exactly.
and people tend to think of you in a certain way, and then you put on them your background that I'm Jewish, and that sort of talks a little bit about a difference of how you see society and how you're
Right.
treated.
Right.
So to let folks know the part when you let someone know that you're Jewish, how does that conversation go?
Well, if you're talking to a white Jewish person, the conversation goes towards, like you just said earlier, when did you become Jewish, right? That's always the next question. Which is hard because then I always have to say, no, I was born Jewish and black people can be born Jewish, and then that turns into a whole different conversation. But if you're talking to a black person, it's almost like this disbelief type thing where they're just like, I don't, like some people will honestly say to me, like, why would you lie about that? Like, and I have to say to them, like, why would I lie about that? I wouldn't lie about that. That's not something that I'm lying about. Why would I lie about my religion? It's not just like a talking point. So it's a hard conversation, no matter who you're talking to, and that's why a lot of times I don't even bring it up
So,
because
so
when I
right,
have the
so
conversation.
when you talk to a person and they'd say, "Hey, we'd like to come to my church on a Sunday." Let folks know. I found that interesting. Let folks know in our audience how that conversation goes after that.
So whenever someone asks me, come to church with me on Sunday, I said, well, why can't you come to synagogue with me on Saturday? And it's always this flustered kind of stammering, like, and I'm like, well, why am why do I have to see what you do? Why can't you also see what we do? I think that's kind of the conversation that I like to have with people because a lot of things about Judaism, just in general, there's a lot of misconceptions. And there's a lot of misconceptions with Christianity as well. So I feel like if I can be open to learning about what you do and coming to see what you do, it would be nice if I could get the same back.
That is true. And
Okay.
so Ladies and gentlemen, you're listening to Skylar Washington. Besides being black and Jewish, she's also a medical professional. We have to talk to you a little bit about what's going on with COVID 19 and Corona and what you're doing these days as well, because that's important as well.
Yeah, so I work for the health department for Richmond City and Henrico County, and I manage long-term care facilities and assisted living facilities. And it's actually been interesting on the epidemiology side of the COVID, because a lot of my friends are working in the hospitals or working in the ICUs with actual COVID patients. But it's been interesting, working with the data and just trying to figure out, how do we keep these residents safe in these nursing homes? Because that's my main goal. I want to make sure that they don't have outbreaks and make sure that everybody's staying safe, because the older population is one of the biggest populations that are at risk for COVID. So, yeah, we've been trying to make sure that, it doesn't go around the nursing homes. And if we do see it in the nursing homes, we're trying to make sure that it doesn't spread. We've been doing contact tracing and lots of different things to try and make sure
How,
that this is.
so when you guys are trying to contact tracing, how effective has that been? Are people playing along with that, or is it really difficult?
It's been hard. I think a lot of people are very skeptical, as they should be. Um, it's hard when, all of this civil unrest is going on, and then people don't really have a lot of trust for the government right now.
And
And
now
if you
they're
come in
asking you
and
your
say,
information.
right. And so if I say, where were you 2 days ago and who were you around and can I have their phone number? People are like, no. And they'll say, I was at home and, and I didn't do anything and I didn't talk to anyone. I didn't see anyone. And I understand, because I personally wouldn't want to get that phone call either. But at the same time, it's about the people around you, right? And it's about making sure that you know that you are being safe for the people around you. And I think that's something that has been missing a lot throughout this entire pandemic with the masks and everything. And it only gets worse with the contact tracing, honestly. So we just try to do our best, and we try to say, especially from, the local health department stance, that we're just here to help. We're here to give recommendations. We're here to give guidance. And you're not going to get in trouble. Like nothing, there's no consequences. If anything, you'll get more resources, you'll get more contacts, you'll get more help. And that's kind of what I try to do.
Alrighty, folks, that is Skylar Washington. So Skylar's going to come back and talk to us every so often and let us know what's going on out there from her perspective. As folks, as you hear, she's wise beyond her years, and I'd just like to thank her mom for, coming on the program before, and also, all the things that you guys are doing out there. So Skylar, thanks, and we'll be in touch.